Hello, everyone, and welcome to this webinar entitled Coping with PTSD. I'm Dr. Trish Murray, physician, best-selling author, and the Health Catalyst speaker. Thank you so much for taking the time to join me today to talk about post-traumatic stress disorder, or often known as on the slide says, PTSD. Now, before we jump in, let's get started by defining exactly what PTSD is so that we're all on the same page. According to the American Psychiatry Association, PTSD is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrorist attack, war or combat, rape, or other violent personal assault or trauma. A diagnosis of PTSD requires exposure to an upsetting traumatic event, but that exposure needn't be firsthand or direct. For example, PTSD can occur in an individual learning about the violent death of someone close to them. It can also occur as a result of repeated exposure to horrible details of a trauma, like in social security workers who are exposed to details of child abuse cases. So as you can see, PTSD has a very broad spectrum of possible causes. Now, PTSD has been known by many names in the past. One of them was shell shock and was once only associated with military service members. But today we know that PTSD can happen to anyone of any age who experiences many different types of trauma. Many people who are living with undiagnosed PTSD may not categorize their experience as trauma when in fact it was traumatic for them. Here are some examples of events that could lead to PTSD, but is by all means not an exhaustive list. Witnessing domestic violence, experiencing either physical, sexual, or emotional abuse, either firsthand or secondhand, sustaining a severe injury, being involved in a serious accident, witnessing or experiencing an act of violence in school or the community, perceiving an experience, any experience at all, as life-threatening or extremely dangerous, natural disasters, home invasion, neglect, house fires, and the last on this particular list is the suicide of a family member or a friend. Now, about 50% of all people will go through at least one traumatic experience in our lifetimes, but not everyone will develop PTSD. In fact, the majority of people actually won't. But when a traumatic event happens, it's actually normal for people to have nightmares or flashbacks for a few weeks before the symptoms eventually improve and essentially resolve. But when those symptoms do not improve, mental health evaluation and the potential diagnosis of PTSD should be considered. According to the National Alliance on Mental Illness, a person who experiences the following intense symptoms for more than a month after some traumatic experience may have PTSD. First, at least one re-experiencing symptom, such as flashbacks, nightmares, frightening thoughts. Two, at least one avoidance symptom, avoiding thoughts, feelings, places, objects, or events related to the traumatic experience. Three, at least two arousal and reactivity symptoms, such as easily being startled, feeling tense all the time, insomnia and difficulty sleeping, and outbursts of anger. at least 2 cognition and mood symptoms, such as difficulty remembering details of the traumatic experience, negative thoughts, distorted feelings, or loss of interest in the typical daily activities. It's important to note that PTSD-related symptoms may not occur immediately after the traumatic event. They may not surface until weeks or even months after the event. Another key difference between healthy reactions and a PTSD response is that while most will remember the fear they felt during trauma, PTSD can cause a person to actually feel as if they are reliving that fear. In a majority of cases, possibly up to 90% actually, PTSD is accompanied by another mental health disorder, such as major depressive disorder, anxiety disorder, borderline personality disorder, and alcohol use disorder. With PTSD, healing doesn't happen overnight, nor will memories of trauma disappear completely. Knowing that there is no immediate cure can be frustrating and make people feel hopeless or helpless at times. Fortunately, by taking the right steps to support yourself, overcoming your PTSD symptoms is possible. So now let's dive in to some of the details around these things. First off, whether you've been officially diagnosed for years or you're in the beginning stages of overcoming or dealing with the terms of PTSD, it's important to continue educating yourself. While it's common to feel isolated and alone when living with any mental disorder, one way to take back some power is to research common symptoms and the condition in general. This way, you feel better about not being alone in your thoughts and also have an improved ability to discuss and explain your PTSD to others who want to support you in your recovery. And one suggestion in your research is to read books by this particular physician, Dr. John Sarno, who is an MD that has actually studied and written about the mind-body connection to pain for many, many years. He actually coined a condition he calls tension myositis syndrome, that in more recent years, he actually has changed the name to tension myoneural syndrome to combine muscles and the nervous system. And also to downplay the itis, which refers in any medical term to inflammation, and therefore focus more on the effect of tension and emotional upset and what they have on the muscles and the nervous system, rather than the discussion of inflammation. He talks about stress and trauma increasing what's called the sympathetic nervous system. The sympathetic nervous system is your fight or flight nervous system. And if this is really, turned up a notch or quite turned up relating to exposure to trauma to the point that the muscles are tight and therefore tense, that will then also have an effect on blood flow, and the blood flow will be restricted, which then will lead to pain. And in my career, and understanding the tension that people experience from anger, anxiety, fear, trauma, absolutely causing chronic tension throughout, particularly in my view, a person's what's called myofascial system. The fascia of your body surrounds everything in your body, every muscle, every organ, every blood vessel, every nerve, for example. I actually call the fascial system the fabric of life. If it gets tense and tight and dried out, it absolutely will restrict blood flow and oxygen delivery to the tissues throughout your body. So I totally agree with Dr. Sarno. And if you or someone you love is dealing with PTSD, along with physical pain that goes along with that trauma, I highly recommend reading Dr. Sarno's work, because he will have some suggestions along with other research you may do to try and help you with your healing. Speaking of support, connecting with people who are going through a similar situation as you can be life-changing. And interacting with people who are in various stages of healthy recovery can be invaluable to your healing. There are many resources offered both in person and online. I did a Google search, for example, for PTSD support groups near me. So that's what I typed in the Google slot, PTSD support groups near me. And a number of options to look further into came up. Anyone could do the same to get started in finding a support group either in person or online. Now, if you're not ready to talk to anyone about what you're going through yet, at least make it a point to stay social and be around other people. Even if you consider yourself introverted, it's important not to isolate yourself or withdraw from typical social activities. Some easy ways to spend time with others could include going for a walk outdoors, having some morning coffee with someone, playing a card game, talking to family or friends on the phone, sharing funny stories or photos to an online community, or even sitting amongst people like in a library or coffee shop or a diner. Even if you're sitting quietly reading a book or a newspaper, you're simply at least sharing a space with other people moving around and around you, and that can sometimes feel very comforting. And now the flyer that you see, I want to make sure I let everyone know about this upcoming seminar we are holding at my clinic, Discover Health Functional Medicine Center. A local psychic, hypnotist, and Reiki master by the name of Sarah Moore during this seminar will focus on the concept of emotion and physical connection of pain or other health problems. She's going to give an overview of this realm in one's overall health and explain examples of how trauma and emotions can cause physical pain and illness, and also initiate a discussion and give examples of what you can do to initiate some healing. She's also going to take the group on a guided visualization to explore the emotion and physical connection and give suggestions for tools to move forward in your healing. This particular seminar, as you see on the flyer, is being held on Friday, June 24th. So that's not tomorrow, it's a week away. And it will be held at my health clinic, Discover Health Functional Medicine Center in Conway Village, New Hampshire. To register, either go to my website, discoverhealthfmc.com, and then click on the event calendar on the homepage of the website. Go to the date, Friday, June 24th, to find the information and the link to register. Or, as the flyer shows at the bottom, you could just go to Sarah Moore's website, enlightenedhorizons.com, in order to register. But I highly recommend the seminar if you would like to be able to understand more and also experience some specific guided visualization to help you process and move forward. Now, historically, mental health issues have been attached to stigma, but our culture is changing vastly. Today, it's completely acceptable to disclose your PTSD diagnosis to your human resource department at work so that reasonable accommodations can be made. And these accommodations might include an altered work and break schedule, working around therapy sessions, a quiet office space or devices that create a quiet work environment, specific shift assignments, permission possibly to work from home. You should know that it is illegal for an employer to fire you or discriminate against you, like rejecting you for a job or promotion, forcing you to take leave simply because you have a mental health condition. That is not legal at this time. Now, many people who struggle with mental disorders are tempted to self-medicate with alcohol, drugs, or other substances. Be hyper-vigilant of when and why you partake in such substance use, even if it's just an extra glass of wine. And ask for help if you are worried that you're going down the wrong road. Also know that while substance use can act as a temporary Band-Aid, they can also worsen many symptoms of PTSD, interfere with your treatment, and add to problems in, of course, your relationships. Now, your attitude and behavior are influenced by all of those people that you spend time with. Take a moment right now to, in your mind, list the 5 people you spend the most time with. Once you've listed those 5 in your mind, would you describe them as generally positive, happy, and thoughtful? If yes, then that's great. If not, it might be time to reevaluate your relationships and actively find people who will pull you in the direction of positive recovery that you need. Now, everyone can benefit from relaxation, but for those living with PTSD, taking the time to include relaxation techniques in your everyday lives is especially important. Relaxing is more than sitting back and watching TV, too. To effectively combat stress, you need to activate your body's natural relaxation response. This means taking intentional steps to lead your body into a state of deep rest. Slow your breathing and heart rate, lower your blood pressure, and bring your mind and body into balance or coherence. And one of the best ways to do this is by engaging in any activity that makes you focus on breathing, whether that's yoga, meditation, Tai Chi, rhythmic exercise or dance, or just taking a moment to focus on specifically breathing. And we offer through Discover Health a movement membership that is called exactly that, Discover Health Movement Membership. This is a monthly subscription that is completely online, so you don't even have to go out of your house. It's an exercise program that you can do either from your own home or any time of day that fits your schedule. Or you can come live to our studio in person to participate with others if that's the way you choose to do it. Now, there are 3 classes per week. One is called Discover Yoga. The other is called Self-Myofascial Release. And the third is Movement for Longevity. Each class has a different focus based on its title and so forth, but all of them involve deep breathing, relaxation, movement, in order to help relax and focus and bring balance to the body and the mind. Exploring gentle movement and optimizing myofascial release of tension to improve blood flow and oxygenation to your myofascial tissues and brain will help with emotional balance as well. Information and registration for this program is right on the homepage of my website, discoverhealthfmc.com. Now, the type of breathing that you need to use in order to calm stress in your body and mind is different from just your everyday breathing that we're not even conscious of. I'm going to go through sort of the description of how to do this. And as I go through it, I'm going to go through it slowly. So let's kind of do this together. So here's how to practice effective deep breathing. So first of all, sit up comfortably in a chair. You could lay down to do this as well, but right now with listening to the webinar and so forth, let's just do it wherever you're seated, paying attention. Let's put both feet flat on the floor. And for right now, put your hands kind of on your thighs, but then, resting and making sure you're comfortable. And now what I want you to do is put one hand on your chest and the other hand on your stomach. Now with your hands, one hand on your chest and one hand on your stomach, I want you to simply take a deep breath through your nose and fill your belly with air, expanding your diaphragm to the point that the hand that is on your stomach should rise or start to extend outward or move, while the hand on your chest should barely move at all. So try that. Take a deep breath in, fill your belly with air, and have your hand move that's on your belly, but the chest one shouldn't move much. Now, when you exhale through your mouth, I want you to push all the air while contracting your abdominal muscles to expel all of the air you possibly can. Again, this time your hand on your stomach should move, but the chest should move very little. And you would just keep repeating this. So again, take a deep breath. Notice the hand on your belly expand. Breathe in as much as you can through your nose, and then exhale and let the hand and contract the belly muscles, and watch and feel the hand on your belly come back in. Now you would repeat this as more repetitions are added. One can focus on having, for example, the exhalation when you're breathing out be longer than the inhalation phase, because by making your exhalation longer than your inhalation, you will enhance your parasympathetic nervous system, which is your rest and digest nervous system. And that will help you relax even more. So take a moment and continue to breathe in and out, extending your belly, seeing the hand that's on your belly and feeling it move out, and then exhaling as much air as possible. And also concept of trying to make sure that the exhalation is longer than the inhalation. Now, if you want to add an extra element to this practice, pick 2 words. The first one word that you want to benefit more from, such as the word strength, or the word hope, or the word happiness. So a beneficial word. And the second word that you would pick would be one you'd like to feel less of, such as worry, sadness, or anger. Now you can add these to your breathing, meaning in each time you breathe in, you would say in your mind's eye the positive word. And with each exhalation, the negative word, you would say in your mind's eye in order to let go of it. So you would say the positive word on the inhalation and the negative word, the word you want to let go of and release, on the exhalation. And you would practice this for at least 15, 20, 30 seconds, whenever you're going to do it. You could even do it for, a couple minutes. But if you even took time each day to do this for, a minute at least, you would start to see benefit. Now, study after study, folks, shows that spending time in nature is a great way to boost morale and aid in recovery from PTSD. Why? Because feelings of awe, as opposed to joy, pride, amusement, content, or other positive emotions, is the singular sensation that goes the furthest in raising one's overall sense of well-being. When was the last time you felt awe-inspired? And I can tell you there's no other better place than to feel the sense of awe and awe-inspired is to go out in nature and just take in its beauty and just be present with it. Now, we all know that we should be eating more vegetables. But if you're living with PTSD, your diet is extra important. This is because the food you eat affects your hormone and stress levels. And if those levels are already low or compromised in any way, you'll want to take extra care to limit inflammatory foods and eat well-balanced, nutritious meals. The best place to start with is to limit processed foods, fried foods, refined starches, and of course, sugar, which can exacerbate mood swings and cause fluctuations in your energy. If you are looking for help with this, you could read my first book, Make a Dent in Chronic Disease, and learn how to eat the rainbow, and also learn about how a comprehensive elimination diet can help you detox, and then identify if you have any what are called food sensitivities. And if just reading a book and implementing treatment on your own is not your thing, then make sure you call my office to talk with our health coach about our what's called Fundamental Functional Medicine program. That's a 3-month program to really hold your hand and help you get going and know how to do this. Now, one rule of thumb you can get started with right away is prepare your meals at home with whole ingredients from the outsides of the grocery store. Don't go down the aisles too much. That's where all the processed food is. All the real food like fish and meat and vegetables and fruits and eggs and things like that are in the outer, along the outskirts of the grocery store. So whole ingredients should be filling the majority of your plate with plants. Now, sleep is just as important as diet, exercise, or any other element of your health. Therefore, your bedroom should be considered in your mind a sanctuary. Use these steps to give your sleep space a makeover. First, remove clutter, or at least hide it away in drawers or behind a curtain. Limit electricity. If you must have a TV in your room, don't make it the focal point. Keep it off to the side or tucked away, and don't fall asleep to the TV. Create soft lighting with fairy lights or lamps or anything else that isn't a harsh overhead light. Don't keep work-related things in your bedroom. If you must have a desk in your bedroom, try to keep it out of view with a curtain or a room divider if that's possible. Pick a bedspread that makes you feel at peace and decorate it with that same feeling in mind of peacefulness. Invest in something that makes you look forward to going to sleep, whether it be a nice pillow, a particular soft blanket like Linus, or a new mattress. Save your bed for 3 things and 3 things only: sleep, sex, and sickness. Don't bring work, meals, or anything else that isn't associated with those 3 S's into your bedroom. Now, people who are living with PTSD can feel easily overwhelmed, fearful, and anxious. One of the important steps in recovery is figuring out what triggers these emotions so that you can better prepare for how to cope with them when they come up. For example, if you know that you're triggered by muscle tension, which can turn into feelings of panic, you can learn to recognize those feelings and partake in some deep breathing exercises and some gentle stretching to combat a downward spiral. Or if you're presented with an invitation to watch a sad movie, you might choose to say thanks, but no thanks. Some examples of internal triggers to someone's emotions can include feeling lonely, anger, sadness, feeling vulnerable, muscle tension, memories, and physical pain. Some external triggers can include news programs, movies or TV shows, certain smells, could actually trigger. And anniversaries, so be mindful of if one is coming up. Holidays, places that remind you of the event, and of course, certain people. Now, again, research has shown that people struggling with PTSD can benefit from keeping a journal in order to have a consistent place to share and process their experiences and their thoughts. If the idea of keeping a journal sounds awkward or unappealing to you, try just scribbling thoughts down on a scrap of piece of paper. Your writing doesn't need to be legible, and you can even throw away the paper when you're done. The important part is that you're sifting through the messy thoughts in your head and laying them out in some external way. Now, mindfulness is a buzzword that everyone's talking about. Well, what is it, and how can it help you? Basically, rather than worrying about the future or dwelling on the past, practicing mindfulness helps shift your focus to what's happening in the present moment. Now, of course, this is easier said than done. One of my favorite ways to practice mindfulness and snap back into the present is to stop what you're doing and list 3 things you're grateful for. So if you become aware of in your day and you realize your brain is just going and going and ruminating and off on its own, stop and ask yourself, what am I grateful for right at this very moment? And that will help you bring yourself back to the present time. Now let's stop and take a deep breath and think of 3 things right now that you are grateful for in your life. If you are interested, you could even share with the group by typing them in the chat if you'd like. No need to have to share, but if you want to, you could even put them down in the chat, or for yourself, write them down on a scrap piece of paper like we just talked about in the journaling section. Now, the process of recovery, folks, is not linear, and there is no magic pill that will make you better. This can be frustrating because we live in a time that expects instant gratification, but it's okay. You've already taken an important step, perhaps the most important step of all in your recovery, by opting into this event, because the first step in healing is to realize that you want and need support. Now, with all the self-help related options I have discussed so far in this webinar, I also want to let folks know about an evaluation and treatment modality that I have provided and offered to patients for many years now in my clinic. And I find this modality extremely beneficial to people dealing with PTSD and other mental health conditions. This is called neurofeedback. And neurofeedback is a form of a biofeedback treatment modality that focuses on shifting a person's brainwave frequencies, or the speed of one's brainwaves, to improve brain function and to quiet the mental chatter and quiet the stress. The brain, you see, is a computer, and it runs on electricity. And the speed of a person's brain waves, or that electricity running through the brain, may be erratic in a person who has experienced emotional or physical trauma. The brain may always be on high alert, for example, and the person cannot seem to feel like they can relax. This biofeedback modality over time helps the brain waves come into more optimal range, so that the person feels more calm, more rested, more relaxed, and can think more clearly. It's actually like going to physical therapy for your brain. Now, if you are intrigued and you would like to learn more, a person can Google neurofeedback to learn more, or you could go to, again, to my website, or you can go to our Discover Health YouTube channel and search for presentations I have given on neurofeedback. And of course, if you're interested in talking to someone in my office about this modality further, you could either email us at discoverhealthcoaching@gmail.com, or you could call the office at our phone number of 603-447-3112. I did a podcast a while back with Colonel Jill Chambers of the U.S. Army about neurofeedback. I mean, we talked about many topics, but Jill, was again a lifetime U.S. Army colonel, amazing person. And it's always good to hear from someone else who has benefited from any modality. And so I want to share this short testimonial about neurofeedback with you.
When all was said and done in 2009, when I'm getting ready to retire, I was happy. Everything was launching, and I went and had my physical to leave, and it was determined that I had post-traumatic stress. little did I know, but I thought it was normal to sleep 2 hours a night, and I thought having nightmares about burning aircraft for 9 years now, 8-9 years, it's just normal, and I'm not going to talk about it. Like, wait a minute. I need to get myself healthy because this isn't normal. So that was really the path that encouraged me. I knew I needed to take care of myself, number one, before I could do anything. And I knew that pharmaceuticals, for me, it wasn't the way. I had seen what happened to a lot of our service members, and it was pill after pill after. Some of them were taking 20 to 25 medications at a time. Mm-hmm. And its effects were devastating. And a lot of those effects led to a lot of suicides. So, okay, so I went down the road of guided imagery, neurofeedback, and biofeedback. I had some really remarkable friends in that arena. Belruth Naparstak with guided imagery, and led me to some biofeedback and neurofeedback. And I retired in April of 2009, and by August of 2009, and I was diligent. I mean, I listened to my guided imagery every day. I did my neurofeedback and biofeedback every day. And honestly, since August of 2009, I haven't had a nightmare since.
To wrap this up and to wind down now, there are a number of references that were used in the making of today's event. And as I always do with these webinars, we're going to post a list of references that were used to create this program for people to explore further for yourself tomorrow in our Discover Health Facebook group. If you are not already a member of our Discover Health Facebook group, and you do go to Facebook and interact with Facebook, then just go on Facebook, look up Discover Health Functional Medicine Center, and just go to our website, our Facebook page, and simply request to become a member of our Discover Health closed Facebook group. It's a group where people can ask questions. It's a place where our health coach, Coach Trish, posts daily quotes and things for health, and answers questions and all sorts of things. So, and then every month we put these references for the different webinars. So please check that out. If you do not engage with Facebook, we also will send you the list. Just let us know if you're looking for it. So thank you for participating with us today. I hope it has helped and that you've learned some things. And I want to leave you with this quote on the slide. There is no timestamp on trauma. There isn't a formula that you can insert yourself into to get from horror to healed. Be patient. Take up space. Let your journey be the bomb. You see, may your journey find answers and healing as we all come into this life as wounded warriors, with lessons to learn and questions we seek to answer. That's why we come into these bodies. So God bless everyone. Thank you so much for coming and participating, and I hope the information I've shared is helpful.